interpretation of the spirometry, be attentive please, is very, very important. Interpretation of a spirometry, the ratio we are going, that ratio in the healthy people, ratio will be the normal. But we are evaluating the case for patient of breathlessness or the respiratory distress. So if we find that the FEV1 ratio, this ratio is low, now we are heading actually towards the diagnosis of obstructive lung disease. So if is obstructive lung disease, just in between, another observation is important, that what about the value of forced vital capacity? This is normal or abnormal? So if the FVC is abnormal, FVC is normal, is more likely obstructive lung disease. More likely obstructive lung disease. But if FVC low, it could be a mixed disorder. This is very important information for you. It is obstructive apparently as ratio is low, but if the FVC also low, the forced vital capacity also low, it's obstructive, or it could be a mixed disorder. Just asking Dr. Shahriar, please, can you tell one disease where the feature will be a mixed one in the lung disease?
Obstructive and restrictive both.
Obstructive, yeah. One lung disease.
Patient is having rupture of emphysematous bulla like this.
Emphysematous. Not very simply, we can say the bronchiectasis.
Yes, bronchiectasis. Like
bronchiectasis can show sometimes obstructive, sometimes restrictive, and sometimes combination of both. So this is one of the example of mixed picture. So this is that mixed picture. Now come to the right side of this algorithm. If this ratio is normal or high, so what could the possibilities? We are actually heading to diagnose the obstructive disease, restrictive disease. And now again assess forced vital capacity. If it is low, it is possibly restrictive disease. But if it is a normal or high, it may be the normal lung, could be normal or high. Normal lung, okay. So to be confident about the diagnosis of restrictive disease, we expect that the ratio will be normal or high, but forced vital capacity usually to be low to diagnose restrictive lung disease. So this picture is very, very important, and we have provided to you beforehand. I think everything is clear to you. If you have any query, please raise your hand and you can discuss. Any query? Dr. Rizwan, please. Any query do you like to ask now?
No, sir.
It's okay. It's okay.
16.
So muting all of you, then be refreshed and raise your hand after going through the case. Lung hyper-expanded means emphysema, but having bibasal crepitation. So it gives an idea of interstitial lung disease, but not PLAB, nor had any lymphadenopathy. Patient does not have any lymphadenopathy. So FEV139, FVC 72%, KSEO 53, KSEO also low, chest X-ray, hilar eggshell calcification and some upper zone fibrotic changes. Dr. Rizwan, can you explain the case to us first, in short?
Yes, sir. The patient having FEV1
low,
less than 70%, low. This is very low, and KCO is also low, 53%. The chest X-ray is showing hilar eggshell calcification with upper zone fibrosis. The hilar eggshell calcification, I think, it goes more with silicosis, sir.
Silicosis, you are thinking. Silicosis is a cause of fibrosis as well, and eggshell calcification suggests more in favor of diagnosis of silicosis, you mean. Okay. Any other opinion from other colleague, please? Anything else?
His profession is major. His profession is major, so he's more exposed to silicon. Yes, dust and silicon, and
Okay, silicon is there, no problem. But
this is my
again, the game changer issue is eggshell calcification here. More features.
consideration.
And this is
Very low.
this is silicosis.
Silicosis.
Thank you, Dr. Reza. And just for you and for me as well to remember, silicosis eggshell, S for S. Now clear? S for S.
Again,
Silicosis eggshell calcification.
it's per cell. Yeah.
May be helpful for memorization. So again, come to that issue, the FEV1. If you come to that one here, the FBC force vital capacity. Suppose this is obstructive lung disease. Now you can remember the algorithm. In this case, this is obstructive lung disease. Now, in the obstructive, that the value is less than 70%. So there may be two again. One is the pure obstruction, another the mixed picture.
Mixed, yes.
If Dr. Shariar, if you look at here, is it a mixed picture or purely obstructive?
I think it is mixed picture because FVC is force vital capacity is not near.
Yes, FBC is low.
Low, yes.
So is a picture is mixed picture. Mixed picture.
Mixed picture, yes.
Yes, Dr. Atar, for you, it's a very nice algorithm.